Anybody have those three conditions? I mean, history of the three conditions: sprained ankle, mammogram, root canal. So just grab the breast. Put the head into extension. Okay. Put the head in extension. So you understand it doesn't show until you put the head in extension. Mm-hmm. So that's the key. If that area of the body has an old injury or not, grab the ankle. Head. Okay. How about the other ankle? No, just the right ankle. Okay. So here's a good yardstick. Memorize this. How far does she go? About 90 degrees, right? Okay. So let's clear the ankle. Grab the ankle. Head back. Okay. Now keep your hand there, and we go into flexion, which activates the proprioceptive nerve endings in the neck muscles. The neck muscles have 5 times more proprioceptive nerve endings than any other muscle in the body. So what you're doing is you're activating those nerve endings by doing that. You say, well, how do you know you've done it long enough? Well, when the extension no longer shows. See, that's gone when she goes back into extension. So what happened to this? Does it work in the right hip joint only? No, it works on every joint. It just so happens we measured the right hip joint only. Okay, now let's do this. Grab the whole breast. Okay. Now keep the hand there. It's the mechanoreceptors that we're activating. Mechanoreceptors. 5 times more in the neck musculature than anywhere else in the body. We're stimulating the mechanoreceptors by doing that. And now extension. That's gone. Extension. Okay, keep the hand there. Extension. If you're ever asked to do a kinesiology demonstration to a group of prospective patients, this is a good thing to do. And obviously she and I did not rehearse this. That's what happens when you erase the memory of old injuries. He's asked me, could I pull the ankle apart to separate the mortise joint, which exists between the talus and the tibia. You could also do it that way. The rule is you do that one from the waist down, and you do the neck one from the waist up. In my office, I'll usually do both. I'll do the neck flexion, and I'll pull the mortise joint apart. If I do them both, I get better results than if I just did one. So it makes for a dramatic demonstration if you're showing an audience who's not familiar with kinesiology. The question is, what about the root canal? I would have her touch the tooth that had the root canal, preferably inside the mouth. Now here's a screening test. Put your tongue between the upper and lower teeth on the right side of the body And then just bite down on the tongue lightly. Now do it on the left side of the body. Now do it on the front. Okay, she didn't show any. If you bite down on the tongue, that's the same thing as therapy localizing. Or you're using the tongue rather than your fingers. Now, if it showed, then you'd have to, let's say it showed on the right, then you'd have to go tooth to tooth to tooth to find out which one it was. But the screening test will tell you, is it left side, is it right side, or is it the center? So we would, once we found the tooth, then she would touch the tooth, keep your finger there, and I'd go into the flexion to erase it. And root canals are pretty devastating, meaning that they affect the entire body is what that means. Usually, not always, but usually we can accomplish the same thing as a root canal by shining a laser on that tooth. A laser means a helium neon laser that has the wavelength of 635 nanometers. Usually we can neutralize the tooth with that, and that they no longer need the root canal. Usually. And if a tooth is leaking mercury, we can neutralize that with the helium neon laser. It's good for about 30 days. You may have to repeat the laser 30 days later. This is the helium neon laser, somewhere between red and orange. And we just hit the tooth. Hold it on the tooth about 10 seconds. And that usually takes the place of the root canal, and it'll neutralize mercury fillings for at least 30 days. You might have to repeat it 30 days later, but at least it'll stop the mercury poisoning, or leaking is the correct word, for at least 30 days by doing that. She's asking me which meridian would I tap for the teeth, and the answer is the stomach meridian. And there are 8 hypothalamic set points on the face, and you can ask the body which one needs to be treated. The 8 are governing vessel 26, conception vessel 24, small intestine 19, triple warmer 23, gallbladder 1, stomach 1, and bladder 1. So those are the 8 hypothalamic set points on the face. It's common that at least one of those will show up, and then whichever one shows up, meaning whichever one therapy localizes, then that's the one you tap. And that's extremely beneficial for overall health. And in the case of the tooth, the one that usually shows up is the stomach.
I just wanted to verify, you said that if someone, in order to avoid a root canal, like maybe they're already scheduled, you could actually use the laser?
Yes, I said that. Usually. After you've treated the tooth with the laser, you could have them touch the tooth, and then you could ask the body, do you need a root canal? It'll say yes or no. Do I know anything else about taking out the mercury fillings? You need to go to a very competent dentist to have that done. The dadgum dental profession, they tell you that they're not toxic in your mouth, they're only toxic when you take them out. They're taught that. They're taught that in dental school. So when they take it out, they have to treat it as toxic waste material and dispose of it a certain way because it's toxic, but it's okay in your mouth. It's ridiculous. Why is that? Because that's the way they're taught in dental school. Like they're taught in dental school that it's okay to use fluoride on the teeth. They accidentally discovered in a little town in Texas that the water supply in that particular town was particularly high in calcium fluoride, and it did make the enamel harder, and therefore they did have fewer cavities. But the aluminum companies, when they produce aluminum, they have a byproduct called sodium fluoride, not calcium fluoride. And they sell the sodium fluoride to cities to fluoridize their water supply. But it's not the same. They're using sodium fluoride instead of calcium fluoride. And you know how they got away with that? The aluminum companies funded the dental schools to such an extent that they could now dictate the curriculum. And so now the aluminum company donated enough money that they said, okay, now you have to teach the students that it's okay to use the sodium fluoride, which is a byproduct that the aluminum companies used to throw away. And now they can sell this waste material that they used to throw away to cities to fluoridate their water supply. Crime motivated by money. Common story, common story.